immunology as well, and allergies. We have Dr. Morris Cohen, who is our great partner between Clara Maass and Newark Beth Israel. And Dr. Cohen oversees as the chair of our neonatal ICU, where Clara Maass is a level 2 special care nursery. And Dr. Cohen and his physicians provide that high complex care to the babies in need. And also we have Dr. Michael Straker with us. The camera, I think positions changed. Dr. Straker is, here he is, back on my camera, is our director for the OB/GYN department at Clara Maass Medical Center. And we're so proud of the fact that we have this great group of physicians who've come together to be with all of you tonight. We apologize that there's a storm that hit us with the severe weather, and some people have lost power. Some of our speakers in their areas, they've lost power as well. But we really felt that it was so important that we provide the program to all of you tonight. We have members from the community who've signed up. And again, we want to let you have the opportunity to speak with our experts on any questions that you may have on having the most safest delivery that you possibly can have at Clara Maass Medical Center. I know that we also have 2 of our managers from the hospital on the phone with us for maternal child health. Marisol Bentacourt, who's with us, who oversees our labor and delivery unit. And also we have Cindy McMahon, who oversees the neonatal ICU, newborn nursery, and also our pediatric department. So with that, I'd like to be able to turn the program over first to Dr. Ballem, and then we'll get into our panel discussion. We thank the community for all the support that they've provided to us during the pandemic. And again, we want to reassure you that it's absolutely safe to come on back to the hospital, and we're here to meet your healthcare needs as well as for your family and loved ones. With that, I'll turn it over to Dr. Naveen Ballem. Dr. Ballem?
Thank you, Mary Ellen. Thank you for the opportunity to speak tonight. I think this is a very important discussion that we're having with the community. Since March of this year till now, the entire country, and particularly where we are situated in Belleville, faced the pandemic of COVID. I think with the administration, the physician support, we've been able to really put Clara Maass, guide and sail Clara Maass through this pandemic very efficiently and safely. During the pandemic, we made some institutional changes where initially we didn't allow visitors to come in, but now we've opened that back up. So when it's time for your birthing experience, family members are allowed to visit. Early on, we also were doing COVID testing on every patient, every child, to ensure safety. We've had many healthy deliveries. All of the children have gone home safely. So we've navigated the toughest of times through this pandemic, following all CDC guidelines with the support of administration, nursing, and our physicians. So as the numbers in New Jersey have decreased tremendously since mid-March till now, we've seen our number of births and other services reopen. So a lot of our elective services in the hospital are open. I just want to mirror what Mary Ellen had said, basically that the hospital is fully functional and open to take care of all of your healthcare needs. And we are following the strictest of guidelines to ensure the safety of every patient and every visitor that visits our facility. Thank you.
Oh, and Dr. Ballem, thank you for that introduction. I do want to let the callers know that we have Dr. Frank Mazzarella on the line with us as well, a major member in the community when he was in Nutley in his practice. And also you have Terry D'Elmo, our Chief Nursing Officer, who is on the line with us as well. With that, Dr. Ballem, we are going to turn it over to Dr. Michael Straker to give us some insights on our delivery process, prenatal care, and what patients can expect coming to Clara. Dr. Straker?
Thank you so much, Mary Ellen and Dr. Ballem. Just like to, tell everyone, it's been said, but we have kind of gotten through this pandemic, I think, very, very well. We've seen so far that our patient population hasn't been hit the way that the general medicine population has been hit. So women who are pregnant have been delivering safely, have been delivering without COVID being an overarching issue for them, which has been good so far. So far, at our peak, we were seeing about a 10% COVID positive rate, and the vast majority of those women were either asymptomatic or mildly symptomatic. Only 2 or 3 patients that I can think of were symptomatic enough to require care in a different area of our hospital, and those ladies have subsequently done relatively well. When we're talking about what to expect when coming to the hospital, definitely I would like all patients to discuss with their doctors what their protocols are in terms of their prenatal care. But when coming to the hospital, what patients can expect is to be COVID tested when they get to the hospital. They can expect that their partners will be screened. We will not be testing their partners, but their partners will be screened, and we'll be able to be with them throughout the hospital stay. Honestly and truly, the delivery experience has not really been altered for those who are COVID negative, but for those who are COVID positive, we have a room set aside specifically for those who are COVID positive with HEPA filters and negative pressure to be able to decrease the likelihood of spread. We've instituted we're asking that the partners remain with the patients at all time throughout their hospital stay. If those partners need to leave, usually we don't allow them to be readmitted in order to decrease the likelihood of spread. For those who have COVID, again, we have separate rooms available. We will be delivering those patients in those rooms, and for cesarean delivery, we will have rooms set up again with HEPA filters and the ability to decrease spread. The hospital stays, what we're doing currently is we're trying to expedite the hospital stay. So anyone who delivers vaginally, we'd like to again, decrease their exposure by having them discharged within 24 to 36 hours. And those who are having cesarean deliveries, hopefully a discharge in 48 hours is what we're looking to do. Always keeping the patient health and patient safety paramount, not discharging without it being safe and appropriate. With that, if I'm missing anything, anyone can feel free to jump in, but that's what someone can expect if they're coming to Clara Maass for delivery. Safety first, patient health first, and we're still working and rocking and rolling.
All right.
Thank you.
Beautiful. Thank you so much. And next, we'd like to introduce Dr. Susan Morrison. If she could give us some highlights relative to PEDS, the bonding situation between mother and child and family, and your perspective on all that we're doing to ensure that component is being met and keeping everyone safe.
Well, this is the exciting time in your marriage and in your life to have a newborn baby, and we want you to be prepared. And we have shared decision making between your obstetrician and you, and then when you come into the hospital with us, the staff and the pediatric staff and OB staff have spent a great deal of time going through each little detail of how to keep you and your baby safe and have informed decision making. So before you even get to the hospital, we'd like you to ask these questions of your obstetricians. And You just heard from Dr. Straker what he tells his patients, but to be aware of it. Now, some babies will, when you deliver your baby, we have the nurses are all on board. If you're COVID positive, depending on what your decision is, if you have the baby with you or be separated, if you want to have skin-to-skin contact. But once you have skin-to-skin contact, you are not separated from your baby, and you're in your room and with your partner in your room for the entire duration. If you decide to be, because maybe it's beginning to get sick and you don't feel well, then you may decide to separate and have the baby in the normal nursery. We test the baby at 24 hours. And if you're not feeling well, then we can take care of you and let you rest for that day before you go home. During this time, we think it's so critical for your learning, whether it's lactation, for breastfeeding, to wash your breasts, to wash your hands, to wear a mask, and to keep your 6-foot distance from the baby in an isolette. So we provide isolettes for you, for your baby if you're positive. The isolette, the baby will be in the room with you. Nurses will spend a great deal of time. There'll be plenty of signage to remind you, because you're tired. This was labor, and that's what labor is. You're exhausted. So you're going to be washing your hands for 20 seconds. You're going to have a mask on. When the doctor walks in, you always have to have that mask on because, with handling your baby, as anybody should have. We have our mask on when we go into your room. So if you choose to be separated from your baby, and that baby will be perfectly taken care of and will go with you home in 24 hours. If you're going to be circumcised and you're rooming in, you will be the last circumcision of the day. And that's so that we can adequately clean the room and not have cross-contamination from the babies, the male babies, with the other male babies. So we try to be very, very careful with our cleaning techniques and do that. Also, remember to bring your stuff in that you need to take care of you during your labor and your delivery, and bring that car seat in. That's real important so that you can take that baby home the next day. It's like you're exhausted. It's like, oh my God, now I got to get in the car. Let's get that car seat in there. So that's how we do it. But our nurses did a tremendous job with our staff, medical staff, in making sure every step along the way is perfect. And you're even providing food for your partner. I mean, everything. So we want this to be the best time of your life, a new beginning, in addition to your family, and in addition to our Clara Maass family, because we see ourselves as a community hospital and wanting to have you come to us. And it is safe. It's safe. It has been safe even during the COVID peak. We had great outcomes with our mothers and babies because our nursing care is so exquisite. Thank you.
Beautiful. Thank you so very much. And Dr. Cohen, I know one of the components that a mom and the significant other may really worry about is if anything should go wrong with their baby, and looking at the availability of the services that you and your team provide within our special care nursery, that I think some people in the community may not be aware of our level 2 nursery, the very highly competent skill set of the people who you bring on from the physician perspective, as well as the nurses who are in the NICU as well. Could you share a little bit with those people who are participating with us tonight, the benefits that you see about having our level 2 nursery available if, God forbid, it is needed or warranted for the moms and their significant others?
Thank you so much for inviting me, and I want to welcome everybody who has joined us today. I have to say that we certainly were concerned when COVID came and how we were going to deal with it. And I think what we've seen is that we've just had really good outcomes. We, as you know, others have already said, mothers have done extremely well, I think, for a couple of reasons. One, because they're young. But the other one is I think pregnant women try to take care of themselves and try to prevent themselves from getting infected. Turns out that their babies have done really well. Well, we don't really see this COVID infection in the babies. However, little babies, a percentage of them, do have some problems. It's complicated being born and coming out into this world where you have to do everything. You've got to breathe on your own. You've got to eat. You've got to do a lot of things, which, you and I do automatically. We don't think about it, how complicated it is to suck on a bottle or to suck on the breast and to swallow. So babies go through a whole transition, and I'm not going to go into that whole transition, although we can if you would like to. But if some babies end up having some problems, some breathing issues, or they have some problems with being able to tolerate feedings, then we do have the special care nursery. We've got 12 neonatologists on our staff around and available, and who help to take care of these babies together with the hospitalists who are very good at Clara Maass. And so we take care of many of these babies, and most of them will be in that special care nursery, not for very long. Some of them are born slightly prematurely, and they may have to stay a little bit longer. But we've continued to take care of these babies almost as though COVID is not there. The only difference is that the people who are taking care of the babies are taking those precautions, that they're wearing their masks, they wear gowns, they do their hand hygiene. And we do request that all of the people who come into the special care nursery, the ICU, follow the same protocols, that every parent is going to wear masks, that you're going to do your hand hygiene, that you're not going to be using your cell phone. And if you do, then you do your hand hygiene after you've used it. Some of those things that will protect your baby and the other people around you. So I hope I'm not going to see any of you, but if I do, we will take good care of you.
Excellent. And you raised several really great points, Dr. Cohen, that we'd like to elaborate on. I know you may see signs everywhere you go about hand washing, and that truly is one of the most important things you can do, whether you're at home or you're in a hospital. And we don't want you to be fearful at all. We want you to know that you have got the best of the best right at Clara Maass Medical Center. And we are also testing our staff to make sure that they do not have the virus. We've gone through testing our employees. We have over 2,200 employees at the hospital that have voluntarily taken their tests, including myself, negative, proud to say, for where we are right now, which is very exciting, but really hand washing. And when you see people with the mask on, as you're watching people outside in your communities, or when you go shopping for the food store, we're practicing the social distancing, we're practicing wearing the masks. And that is really to ensure the most safest environment that we can for all of you. As Dr. Cohen mentioned, with the neonatologist, all the people on his team, those physicians are available to us. Same thing for our OB staff and our pediatric hospitals. I'd just like Dr. Straker to share with you about our laborist program, and then Dr. Morrison to share about our pediatric hospitalists that we have available at the hospital. Again, two other resources, including with Dr. Cohen, that we have available round the clock, 24 hours a day, 7 days a week. Dr. Straker, could you share a little bit of that site to reassure
Sure.
community?
24 hours a day, 7 days a week, we have an in-house physician who is available to assess or take care of patients who, in an emergency, they will be the initial evaluating physician when a patient comes into the hospital. And again, they will assist if there's a need for any more complex delivery, like a cesarean delivery or any type of operative delivery. So we have board certified physicians on staff 24/7, and we have just hired 2 nurse midwives as well, who are another set of eyes and ears and hands in order to assist in the initial evaluation and care of patients, and they may assist the doctors in making rounds the next day. So they have become an integral part of our labor team. But everyone should know that besides your doctor that you've chosen, we have chosen physicians at our same level who can provide excellent care in the time that we would need that extra help. And hope, again, like Dr. Cohen said, hopefully you'll never have to see them, but if you do, you'll know that you're going to get excellent care from them as well.
Terrific.
Oh,
And
Straker?
and we also have 24-hour anesthesia. So if you need an epidural, any type of pain management, we have anesthesiologists available 24 hours a day, 7 days a week as well.
perfect. Thank you for bringing that up. Dr. Morrison for our pediatric hospitalist.
Well, people picked, some people interview their pediatrician before they could come, and they have their and they're there to help you enjoy your baby. And they check out your baby, they'll teach you a little bit about your baby, but if it's an emergency C-section, it takes time to get to the hospital. That doctor, that pediatrician, board certified pediatrician, is there in seconds and fully mask gloved, everything's ready to go. When talk about neonatologists, so we have a whole team. Our only goal is to have healthy, happy babies and families, and we want everything to go as smoothly as possible for you.
Perfect. And Dr. Straker, I know that we don't have our representative here for our perinatal specialist. Do you want to talk about that specialty group of physicians?
No doubt about it. We have a relationship with the New Jersey.
Mike, you're muted.
Sorry. Yeah, so I'll start again. I'm not sure how much was missed. So we have a relationship with New Jersey Perinatal Associates, which is a group of 9 perinatologists or high-risk pregnancy doctors, or for those who are viewing, maternal fetal medicine physicians who also provide 24-hour care as needed if there is an obstetrical need for that. So those patients that have their private physicians, a lot of them will have seen those doctors at some point in time during the pregnancy. And if there is a high-risk complication, we have them at our fingertips to be able to consult with and see you if necessary. And if, again, the need is there, we have a relationship with them to be able to have them take care of you in our at St. Barnabas Medical Center, should the need be there. So we have a great relationship with those folks, and they've been a wonderful help to us, and they, again, are always available for us.
Dr. Straker?
Yes.
There was a chat question that came up, and I just wanted to pose this to you or to the team if anybody else wants to jump in, regarding lactation specialists, particularly during COVID.
Yes, we definitely have our lactation consultants available. They have been available throughout the whole pandemic. We've never relaxed on that service. We know that it is a beneficial service. It's a necessity to be able to have our moms be able to learn how to feed their babies if they need that assistance. So we always consider them to be essential personnel, and they are there and available to help moms. Only thing they're not doing is they're not doing any group meetings, because again, that would kind of go against the social distancing. So you'll really get a one-on-one consultation with the lactation consultants. Definitely. Great question.
And we really encourage everybody to breastfeed. And so we really make an effort. The nurses are aware of it, and the lactation specialist is there. And we really, that's really, if you can do it, and most people can.
Yeah.
It's not the only
Mary Ellen,
option,
you're muted, Mary Ellen.
Perfect. Oh, there we go. And then I just see Dr. Mazzarella down in my corner here. Dr. Mazzarella, I know that you have a great team of case managers, social workers. They do cover the maternal child pediatric department. Do you want to share a little bit, and maybe Dr. Straker can talk about it as well? Sometimes people could have the blues, what they call the blues after pregnancy, and how your team can assist.
Well, actually that's a trigger. As soon as they realize there might be any element of postpartum depression, then we definitely intervene. And social workers are on top of that, as Dr. Straker and Dr. Morrison will attest.
Yep. So we have all those resources there for you.
We do, definitely. They're a very, very strong social service team.
Yeah, so usually how that works is 24 hours after delivery, the nurses will screen the patients for any high level, high risk of postpartum, using something called the Edinburgh scale. And if depending on the score that the mother will scores on that particular screening test, that will, like Dr. Mazzarella said, trigger the social workers to be called and to come in, provide initial service. Additionally, if they score higher than that, then that is a trigger to help to bring in a mental health professional to be able to come in and provide additional services as well. So we have, I think, all the bases covered in terms of care, from prenatal to postpartum care, that anyone coming through Clara Maass will be, I think, comfortable knowing that we can provide anything that they need, honestly.
Beautiful. Excellent. And I know that Terry Dielmo was on the line with us as our Chief Nursing Officer. Terry and her nursing team, God bless you, Dr. Morrison. Terry and her team have worked really with the parents to help with virtual visits, virtual tours, helping with your prenatal classes before you come on in. Terry, anything you'd like to say to the community out there listening in from a nursing perspective?
Thank you, Mary Ellen. First of all, I want to thank you for considering Clara Maass Medical Center where you're going to have the baby. I have to tell you, we have a great group of doctors that the nurses truly enjoy working with. And we take a team approach to make sure that we're answering your questions and teaching you from the moment that you come in, and answering anything that you may have concerns about or that you may have heard about, so that we can put you and the rest of the family at ease. Because at the end of the day, it's about you and that baby and the rest of your family, making sure that you're going to be going home and you're going to feel safe. And also know that managers, our leaders, check on you every day to make sure that we are meeting your expectations and answering any questions that you may have, so that this way there's not a doubt in your mind that you have had all the information that you need, so that you can continue just loving your baby at home once you leave us. And we're always there for you for any follow-up questions as well. We'll check on you within hours after you leave to see if there's any additional questions that you may have, so that this way, if there's something that you may have thought of once you get home, or once you talk to your mom, she'll ask you if we answered a certain question. We'll be more than happy to provide those answers for you.
Excellent. That's terrific. And I think you'll find that Clara Maass Medical Center is a very friendly, warm, compassionate facility for your healthcare needs, even as your family grows, evolves, children get older, with all the services that are there and the outstanding medical staff and healthcare team members that work together really to give you the best experience and to keep you very safe. I am very proud of the accomplishments between our medical staff and the hospital staff, where we have continuously been ranked by health grades for excellence in labor and delivery and GYN services at Clara Maass Medical Center. So when you come to us, you are getting the best of the best. And all we want to do is be there for you and understand your needs, be sensitive to your needs. And also through our Center of Excellence for Latino Health, we really have looked at that component of patient population that we care for and making sure that we are being culturally competent and culturally sensitive to all the patients that we serve. So we're excited about that as well. With that, I believe that Dr. Ballem is able to see some of the chats that are going on. If you could throw out, Dr. Ballem, some of the questions. I'm having a little bit of a difficult time getting that, and I know that we have about 15 minutes left. So if you want to put some questions out, we'd love to hear and respond back. Thanks.
So the latest question is, apart from your partner, how many visitors are allowed?
Right now, just the partner.
Just the partner.
Recently, they have allowed a doula, but that has to be a certified labor coach. But other than that, that's where we stand with visitors during the laboring aspect of labor delivery. And I want to add on to what Mary Ellen said before. You mentioned the health grades distinction that we got. From my recollection, we're only one of 4 hospitals in the state of New Jersey who received that health grades distinction. So, coming to Clara, you're going to get high quality care.
Sure.
Absolutely.
Yep. And I think the other piece about visitors, and we know that's a concern, this is such a happy time in your life for you and your family, and everybody is so anxious to see the baby, see how you're doing, and check on one another. And we know that the pandemic has not allowed all that love to come through physically and present in the moment where you can view each other and give each other a hug. We want you to know that we've adapted many mechanisms to connect you still with with your loved ones. In the NICU, where Dr. Cohen and his team are, we have something called Angelize, where you have the code that you give to your family of who you want to see your baby. And there's a camera availability that you can take a look at the baby anytime that you want for your family members. We also have the ability to do iPad, FaceTime virtual visits so that your loved ones can check in on you and be with you from a virtual perspective. So we want you to know that although you may not be present, we'll find a way to have connectivity for the most important time of your life and for your baby's life. So we're here to help you through that, and there's no issue on that.
So then, thank you, Mary Ellen. The next question is it possible to complete a virtual tour prior to delivery?
Sure. And Terry, could I toss that one to you?
We would love to do a virtual tour for you. If you send us a time and a date that would work for you, we would be more than happy to tour you, and you can see exactly where our suites are, the rooms, and how where you would have to come in through the elevator, and our security guard who's there to make sure that you're safe and the baby's safe. once the baby's born, and we'll be more than happy to accommodate you. Just let us know the date and the time, and we will make it happen for you.
I think there was a question about COVID testing being performed on mothers and partners. Their COVID testing will be performed on every mother who comes in for delivery. We're not able to accommodate testing every partner. It is also recommended that patients have COVID testing at about 38 weeks and a half, and then weekly if they can through their physician's office. I know that may not be feasible for everyone, but that is a recommendation that would help to kind of ensure that everyone is healthy and safe prior to admission as well. And we also recommend, or we do require, if you're having a scheduled C-section, that you come in 2 days prior for pre-admission testing and COVID testing as well.
And I think, Dr. Straker, just to add to that, we do ask the mom and the person who'll be in the delivery room with them that they please self-isolate because we don't want you to be out and about in the public. The main thing is to keep you safe. So we'd rather you stay away from going to the mall, being around anybody who could be sick, and to stay away from anybody who thinks that they could have COVID, or if they've traveled to any of those states that have been quarantined. That's another big item. And we ask on the honor system that you do that, but that's really for your best interest and the baby's best interest. So that is one thing that we do go over and ask of you to help us do your part for us so that we can keep everybody safe at the medical center.
I'd like to say, while you're pregnant and you go into your doctors for visits, I'm I do allergist, immunologist, and so I try to encourage them to take the first appointment of the day so they can walk in, have their appointment, of course wearing them mask, using your sanitizer, but get the first appointment of the day so the room is actually clean, that you have your mask on, and because you have to go to the eye doctor now and then, you have to go see your OBGYN, you have to see me, the allergist. So these are important things that you can protect yourself, and it works. It's the only thing that we know that does work. Social distancing, wearing that mask, hand washing, isolating yourself, and that makes such a big difference to your baby. It's not just because we're telling you to do it, it makes a difference. We've seen it here because we've used this through the whole pandemic, and it works. Our babies have been done very, very well. So it's not just another thing to do, it's really important to do.
I see there's another question here. Are masks required in labor?
Yes. I mean, the bottom line is yes. We require everyone to be masked. That's partner, doctor, nurses, and the patient as well. Again, it's just an extra precaution to be able to make sure that everyone in the delivery, patient, partner, and staff are kept safe.
You know, there's a new study that shows that wearing a mask just doesn't protect someone else from you. It decreases the amount of, if you're exposed, decreases the amount of virus, and so you're less symptomatic. So wearing a mask protects the person that you're with and yourself.
Yeah.
Yep. Great.
Just wanted to add a point about testing. With our partnership with Rutgers and RWJBarnabas Health, we have access to the best tests that are on the market. Our turnaround time to get the results is very quick, usually within 24 hours. And the sensitivity of the test is as close to 100% as you can get. So the tests that we utilize to keep not only the employees, to test the employees, but the patients and all visitors is of the highest quality.
So I just noticed that on the chat that there's a virtual breastfeeding support group that meets on Mondays at noon. So if everybody's not seeing the chat, think about that. You might want to do that. There's about 25 people. It would seem as though some of you ought to be asking us a question. Ask all the others. Don't ask me.
Maybe it'd be a good idea to see the virtual breastfeeding before you have the baby. So
Yeah.
do better with it, the breastfeeding.
Yep. Excellent. Stacy, any other questions that you received from participants prior to going live today?
So there was one question. Do babies that catch COVID-19 experience complications? I'm sure a lot of mothers are thinking about that, and the fathers too. The reality is, and Dr. Morrison can respond to this, we've seen very little, and even worldwide, there are very few babies who actually get this infection. And that's been a godsend that they somehow seem to be protected. They don't seem to have the receptors to accept this virus. And most of the babies who are young children who've gotten it have gotten it not from the time of the delivery, but actually have gotten it after they go home. So it's going to be important after you get home that you don't spread this among family members and spread it to the baby. So either that, keeping some distance, wearing a mask some of the time, and doing good hand hygiene is going to be good. And I think that's something you need to talk to the caregivers about while you're in the hospital.
And I think to limit the number of caregivers too, and that the physical distancing. You don't have to have a baby on your lap all the time. You can have it in the bassinet at the other side of the room. And babies sleep like 23, 24 hours a day anyway in the beginning. So that first month is really important. The babies do get sick, but it's rare. Sick with COVID, but it's rare, but they do. And so it's important not to let your guard down after you leave your hospital. Absolutely. Most of them are getting, the ones that are sick are getting it after they leave. Remember, if you're positive, you're contagious to other people. That means your mother, the grandmother, your partner, or your other children. And babies do have fewer receptors in their nose to have the virus bind to make them sick, but they still can spread it a little bit too. So it's real important to not let your guard down. After all, the most important things that you've done, and we want to keep the baby healthy and happy and have a happy family. It's not fun being in isolation.
No.
Next question on the chat is, I am a first-time mom. Will there be help available?
Absolutely. We have not decreased services. That was we have superb nurses who will take care of you and be able to be available for any assistance you need 24 hours a day, 7 days a week. And again, we have physicians who are on call, on staff, and if there is an emergency in the middle of the night, there will be help. So, and we have the lactation consultants who are there mostly throughout the day. But again, our nurses are good too, and they'll be able to help you with any issues with breastfeeding as well. So yes, there'll be help for the first-time moms, for the 8-time moms, for all moms. There'll be help.
Great. Good. And we're happy to take some more questions, or if you prefer, you can certainly email us and we can get back to you. We're available to answer any questions that you may have. And again, I'm just so thankful, and we're so blessed that we have such a great team available. And I see, thank you. We've got a question about a photographer. What's the answer?
From my recollection, the hospital photographers are not available in-house, but I do believe we have the information for them to be contacted after you've been discharged. Trust me, the babies look better the next couple of days.
Yeah,
Absolutely.
but they're available, but not in-house.
Oh, that's cute. Excellent. And thank you to all the participants who had questions. We really appreciate your questions and virtually having a dialogue with us. But again, we're open to any questions that come our way, whether now or you want to save it and ask us in a different venue. We'd be more than happy to make those accommodations for you. Is it safe for the baby to drink the mother's milk? I just missed that one question.
Oh, absolutely.
Was it with COVID?
Yes.
Without COVID, it's absolutely safe to drink your mother's milk.
How about if the baby has COVID? I mean, if the mom has COVID.
If the mom has COVID, she has to wear a mask, but she can pump her breast, and someone else can feed the breast milk. When she goes home, she will probably be nursing. So hand washing, wearing the mask, washing your breast before and after is important.
So they can drink the breast milk,
Yes.
just not from the breast directly.
Not the first, not until the mother feels better, because we don't know when you're positive, you're going to get sick in a day or two, and it's a big strain. If you do get a bad cold, it's worse than a bad cold for some people. For most mothers, it's just that they didn't feel good, they're exhausted, and they feel like they have the flu-like illness.
But it is safe to drink breast milk. There's no evidence that the COVID is spread in the breast milk. So when you're feeling up to it, all you have to do is, as Dr. Morrison said, clean the breasts carefully, wear a mask at the time, and then you can in fact breastfeed your baby.
You know, we have situations where the mother's positive and the father's negative, and the baby's negative. So the mother needs to wear a mask in the house, regardless if you're breastfeeding or not, because of other people in the home that you have to protect. And you kind of forget that. You say, well, I'm here anyway, but you can protect yourself and protect your family members by wearing that mask.
Great. Well, I know that we're approaching the 7 o'clock hour. We do want to wish you all a very safe and healthy delivery and healthy babies. You've got a great team surrounding you and your loved ones through this process, and we are more than happy to be here for whatever it is that you may need. And we want to thank all of our physician participants and Terry Dielmo, as well as our Chief Nursing Officer, and Stacy, for coordinating the effort tonight. We hope that this was beneficial to you all, and we look forward to seeing you when you have your baby. And we're here for you. So thank you to one and all. And unless there's any other questions, we can conclude the meeting. We'll wait 8 seconds and see if another question pops up. Okay, and we thank you all for your positive feedback with your thank yous and appreciation. We appreciate you. Thank you, everyone.
Bye.
Stay safe. We'll see you in the delivery room. All right.
Bye-bye.
Bye.
Bye. Thank you.